In Norway, we have a universal healthcare to secure that all patients have access to the care they need. When you contact the out-of-hours services, does it make a difference which GP you meet? In addition to treating patients, out-of-hours GPs have a crucial and challenging role as gatekeepers for specialized health services. They must secure that the correct patients are referred to the hospital. When GPs make the correct decision not to admit patients unnecessarily, this prevents medical overuse and further reduces hospital pressure and costs to the lowest possible level. In cases of doubt, the GPs may have a differing threshold for admitting a patient. This difference is what we have studied. My colleagues and I took a closer look at which characteristics of the GPs are associated with the decision of admitting or not admitting a patient. Further, we examined if these characteristics are of consequence for patient safety in the following 30 days. We used registered data from Norwegian Health Services from 2008 to 2016. To avoid confounding from varying patient populations between the GPs, we used a model that assumes the patient populations to be comparable between the GPs. We compared patients in the same age groups visiting the same out-of-hours station in the same hours on the same weekday, month, and year. This means that the only systematic variation between them was the GP they met. We found that patients under the care of older GPs, male GPs, and GPs with a specialization in family medicine had fewer immediate unplanned hospital admissions. GPs with low out-of-hours experience admitted slightly more patients. Interestingly, we found only minor differences in unplanned admissions over the following 30 days, meaning that some of the patients that were sent home initially ended up with an unplanned admission within the following month after all. Patients under the care of GPs who had previously admitted many patients had an almost twofold chance of immediate admission. These differences were sustained over the next month, resulting in substantially higher hospital costs. A major finding is that the differences in unplanned admissions between the GPs did not substantially affect patient safety, measured as differences in the 30 days risk of death. So, to answer the question, yes, the GP you meet does affect your chance of unplanned hospital admission. However, fortunately, it does not seem to affect patient safety the following 30 days, a result that is reassuring from a patient's perspective. More details can be read in our article in Family Practice.